Hello, Dr. Day. How are you today?
Great. Good to be back.
Great to have you. We are thrilled to talk all things hair today. So if we just kind of start at the very top, in terms of women, yeah, literally. In terms of women as they age, what are some of the common things that you see with hair in your office?
One of the things that women don't really think about is that just like our skin thins and we get wrinkles in our skin, the hair also ages. And the hair texture can change with time. Usually you see it in spurts, like in your 30s and then sort of in your 50s and then 60s and around menopause. So what happens is that the overall density gets less, but each fiber, each strand of hair can also become finer. So you may have the same number of follicles, but your ponytail will get smaller and smaller because the hair fiber itself is just less thick and dense. And then as it changes color and sort of turns to white gray, it can become coarse and wiry. So even the texture of it is very different. So that's just the natural change that most women go through. Some women are blessed and they just don't have a hair problem, and those women are the luckiest, and not that common.
Yeah.
But for most women, it's the hair really can age. Now, if you add to that estrogen depletion, that can accelerate the process and really cause problems with hair thinning, both in the temples is one area, but female pattern hair loss is different than male pattern. So men, then in the crown, then it'll all kind of meet and they'll literally go bald. Women, we tend to keep the frontal hairline, but then we'll bald or thin, not so much bald, but thin right behind the frontal hairline in like this crown area. And you'll see a widening of the part and then just a thinning going out. This can start as young as in your teens for some women who are especially unlucky, and it can be from a hormonal imbalance, but certainly is more common with age.
Interesting. And so is the actual, like for women who go through balding, hair loss, is that different than the natural kind of aging of, your hair getting coarser, drier, thinner, finer, I guess?
So women who have the genetic pattern of female hair thinning, that's a special category. It's very
Okay.
common, but
Okay.
that is not everybody. Some women are just going to go through natural hair aging where their hair is just going to thin out or change in texture over time and seem like less, but they don't actually have a hair problem. They're just aging, and the hair changes with age, just like everything else changes with age. Then when I think about hair, I think of it in two general categories at the very, very top. So you think of it as scarring and non-scarring.
Okay.
The non-scarring are all the things we've been talking about, where the follicle is not dead, but over time, the longer it's gone, the less likely it is we're going to be able to revive it. In a scarring process, which again is more common in peri and postmenopausal women, you can see the whole frontal hairline recede. But if you look at the scalp, it's waxy smooth, or you'll see some of the hairs in clumps. And that's because, for whatever reason, we don't know exactly why. It's partly autoimmune, partly seems to be hormonally related. There's a scarring process that's actually destroying the follicle. And then there's another scarring process that occurs more in the crown. And that is also where you could see clumps of hair, and we don't know exactly why it happens, but we do see it more towards the end of perimenopause into postmenopause.
And that scarring, non-scarring, that's all part of like the natural, like when you had the
No,
category. No, it's
no,
okay.
the scarring, non-scarring. So there's the natural aging of the hair is a non-scarring process
Okay.
that most women will go through. So everyone can sort of notice changes in their hair over time.
Yeah.
That's natural aging, and that's generally a non-scarring process where the follicle is just changing with time. It can become finer, thinner. If your hair was curly, it can become frizzy or straight. So the texture and the quality of the hair can change. You might notice that it could break more easily, be drier. All of those things are from just natural aging and how we process our hair.
Yeah.
That's the non-scarring. The androgenetic is now a
Okay.
subcategory of women who might also go through aging, but they're also going through this other process of a specific pattern of hair loss that's a female pattern that is genetically programmed. And
Okay.
it can start at any time, but can often start around perimenopause. and you'll see more with hormonal changes. There's also another non-scarring. Let's stick to the non-scarring because that's the most common autoimmune pattern of non-scarring called alopecia areata.
Right.
Alopecia areata it literally means round patches of hair loss. It's a descriptive name, but for whatever reason, your immune system is targeting the follicles and thinks that they're foreign invaders and attacks them. And the way we treat that is by using cortisone injections to the spots, and that generally helps them recur. If that process becomes where it involves the entire scalp, that's called alopecia totalis. If it involves all the hair on the whole body, that's called alopecia universalis.
Okay.
So alopecia areata, individual spots, anywhere you grow hair, it could be in the brows, could be in the head, it could be in the pubic area, it could be on the legs, could be anywhere where you have hair, but round patches of discrete hair loss is is alopecia areata. It's autoimmune, seems to happen randomly, can happen at any time, but if it now involves the whole scalp, totalis, whole body, universalis, there's 3 drugs that just got FDA approved to treat that particular type of hair loss. Alopecia just means hair loss. Alopecia tells you nothing about what the type of hair loss is. So when someone says, "Oh, I have alopecia," all they're saying is in medical lingo, they're saying, "I have hair loss."
Okay.
So they're not telling you it's not a diagnosis of any particular thing. Then we have to look and say, what kind of alopecia? Is it just natural aging? Is it an autoimmune scarring or non-scarring process? Is it something that we have a drug for now? So the androgenetic, we only have minoxidil topically for women. That's all there is, 5% minoxidil topically. For the autoimmune type, where you can have those discrete patches or it can involve more, we have something called JAK inhibitors, which is an immune pathway, which is actually a really important immune pathway. But we found by accident that this young man had alopecia universalis, so he had no hair on his body, it was autoimmune, and he also had arthritis, and he was given a drug for rheumatoid arthritis that was a JAK inhibitor called Xeljanz. And when he took that drug, all his hair grew back. And
Oh,
it, whoa, this is amazing. All his hair grew back. And then
yeah.
they started looking at this and doing clinical trials. And then that was the first to get FDA approved. Now there's 3 different JAK pathways, and there's 3 drugs that affect one or more of those pathways. The side effects are that it could cause some problems with the heart. Long term, it could cause some problems with cancer. So it's not something that you want to give lightly. But if somebody has missing most or all of their hair and it's that autoimmune process, it is life-changing to be able to offer them a drug now that has FDA approval to work for that process.
So it seems that in terms of this more genetic, serious hair loss, that there are a lot more options now available to
For
women
the
who
autoimmune,
do
it's
this.
not
Yeah.
genetic, it's autoimmune. There
Sorry.
might
Yes.
be
Thank
a
you.
genetic predisposition, but it's an autoimmune process. For
Autoimmune.
the
Yeah.
androgenetic, unfortunately, we don't have a lot. The only drug approved for women is topical minoxidil, 5% once a day.
Okay.
And that does work, but it's not a specific treatment. And this is another point about minoxidil. Minoxidil seems to either improve circulation to the follicle, and it seems to push the hair into the growing phase, which is called the anagen phase, and it seems to hold it there longer. So in the clinical trials that Rogaine did, they had almost 800 women, 80% regrew hair, and the hair that regrew was up to 50% thicker.
Okay.
So this drug worked. Then it just became in vogue a couple of years ago to
Yeah.
give minoxidil by mouth. But the thing about minoxidil is that it's not a specific drug. So it's not working on a specific pathway of the hair follicle. It's doing something that we're not exactly sure what, that seems to either wake up the follicle or nourish it better, give it better blood flow or oxygen supply or something. But if you take it systemically, or if you wherever you put it, it's going to grow hair. So, like with the JAK inhibitors, it seems to have a specific thing for the hair on the head and the brows, and even on the body, actually. But with minoxidil, if you take it by mouth, one is it doesn't work any better than if you use it. Okay, it's less annoying. You're taking a pill instead of using something in your hair, but it works anywhere you grow hair. So if it's growing hair on your head, it's growing hair anywhere you grow hair. And if you're a woman who has been finally got laser hair removal, doesn't want more hair on their face
Right.
or on their legs or anywhere else, then this is it better to use topically. So you just put it where you want it to grow hair and don't take it systemically to have that systemic effect.
Wow, that's really important to know.
Yeah, and it also has other side effects that are not dose related. So the
Okay.
thing about minoxidil is that it was originally used for people with high blood pressure as a blood pressure lowering drug. But it's now a fourth line drug because it has problems. It can cause pericardial effusion, which is fluid around the heart. It could cause swelling of the legs and hirsutism, which is hair growth where you don't want hair growth.
Yeah.
So those are the problems with it. So they've switched to other ones. But now people are just taking it saying, oh, it's a low dose, it doesn't matter. But the heart side effect is not dose related. So even at a low dose, that can be a problem. And if you're not symptomatic, it's not going to be diagnosed, but it's still there. And it could be problematic. It's just, I think it's underdiagnosed. And I think that if you want to grow hair, it's much better and safer to use it topically than to take it by mouth, even though so many people are taking it by mouth saying it's no big deal. I think any drug is a big deal. And
Right.
then sometimes to balance it, they give them another drug that's used for high blood pressure called spironolactone. And that combination, if you have normal blood pressure or low blood pressure and you are very active and you exercise,
Right.
that's a lot of blood pressure lowering for hair growth.
Mm,
Um, so for me, and they're all off label. So I
okay.
don't know. I think people get a little cavalier about taking these pills, but they are all serious. They have side effects. Spironolactone can affect libido. It can affect it's metabolized by the kidneys. It's not going to do much in that way, but it does make you pee more and it makes you pee out more sodium but hold back potassium. So you have to watch your potassium levels depending on your dose. But
Okay.
nobody talks about those things. Now you have a
Interesting.
heart medicine that could affect your heart, and now you take another medicine that can affect your potassisim level. All of it can affect
100%.
blood pressure and make you dizzy when you're working out. You're on a treadmill, you pass out. That's a problem.
Yeah.
And
100%.
people are not aware. Even
Wow.
doctors I spoke with are not aware.
Yeah.
So yeah, so I'm very cautious about just taking pills by mouth for hair growth, especially when they're one off label and two, they don't work for everybody. But now you're taking a pill, you're not sure you see a difference, but you're afraid to stop it because you're afraid you're going to lose hair if you stop it because you're not sure if it's working, but you don't want to lose more hair.
Yeah.
So
Yeah. If we switch back to sort of the natural hair loss or hair changes, I guess really, because it's,
yeah.
a whole gamut. The menopause guidelines don't indicate, hormone therapy as a treatment or indicate it for this. But, what is the evidence around hormone therapy for hair health as we age?
There's not enough. No one's really looked at it closely enough specifically for hair growth. I don't know that it's a specific treatment. I think uh, estrogen is important for hair and for hair health. So the mistake I see around hormone replacement is that a lot of women will say, my doctor said, don't come to me till you haven't had a period for a year. Meanwhile, they've been suffering with
Right.
perimenopause for 10 years, and they would have benefited from the hormone replacement for their hair, never mind the other symptoms as well. So I think the problem is that we don't really have a set of guidelines as to or a standard where we say all women, when they either have these symptoms or their hormones hit this level, they should start this treatment. It's still very much the wild, wild west. There's a bunch of us, Tamsin Fadal and others, Marie Claire, we're all working from all of our angles to try to make it a normal conversation and part of the daily dialogue where we will force medicine to come up with standards for women around perimenopause where there's a time that it's your time to start and it's definitely not 1 year after you haven't had a period. So when it comes to hair, the thing is that if you started later, then depending on how much your hair is affected by it, how much hair you have, how much concern you have about it, how much you're paying attention to it, you may be able to slow it down at that point, but the damage is already done. Because the longer the hair is gone, and by the time you notice hair loss, you could have lost up to 40% of your hair
Oh,
by the time
wow.
it's noticeable. So it's not, and the other problem is it's normal to shed some hair every day.
Right.
For once somebody is attuned to the idea or starts thinking they have hair loss, all of a sudden any hair shedding is dramatic
Yes.
and problematic.
And so, I mean, so this is the challenge in that, guidelines we need, they're important, but they are guidelines. And in the
Yes.
absence of random control trial research, you can't modify the guidelines basically. But,
Right.
the logic would indicate if estrogen is important for our skin and our hair, that as it declines,
Supplement.
it will have benefits for our hair in terms of maintaining its health.
Right, exactly. So the typically if hair is your thing, that's where you notice your changes, then the sooner you start, the better is generally it. And I'm always so curious at how we have women who are taking hormonal contraceptives for
Right,
decades and
right,
think nothing of it. But
right.
then when it comes to hormone replacement, it's a controversy. I
Absolutely.
have I have way more concerns about women taking hormones, which are excess hormones, right?
Mhm.
So a hormonal contraceptive is adding estrogen to someone who's not estrogen depleted. And I mean, I don't think we have enough data. No one really asks the question or thinks about this rise in breast cancer and other issues. They're all blaming postmenopausal estrogen for it, but how much of this is building from women taking hormonal contraceptives for decades? I much prefer women in their younger years using an IUD, like a copper, a non-hormonal IUD, and then around perimenopause, adding in hormones. And when I see patients with hair loss or acne, I look a lot at the gut. You have to look at diet. You have to look at stressors. You have to look at so many other
So
things
much.
before you go to drugs and hormones.
Right. And, I think probably most women, they just, when in their youth, we don't think much about our hair. We just sort of take it for granted. And then all of a sudden it's, going gray, it's getting thin, it's dry, it's maybe frizzy. What can we do, or what should we do to help at least promote the health of it outside of hormone therapy? That's not sort of being sold snake oil. So, I mean, the skin market is one thing. I think the hair market is even trickier, or at least equally tricky, in terms of, what products actually are, healthy and good for our hair.
I think it helps to stay away from a lot of the surfactants as much as possible and phthalates. So it changes the quality of the hair products you use where they're not going to lather and foam so much. So the experience of cleaning your hair is a little bit different. I think there's a difference between cleaning your scalp and cleaning your hair. Your scalp has skin and that needs to be cleansed, but the hair doesn't always. So I have women who have processed hair or drier hair, put conditioner or a mask on the ends and then shampoo the scalp. So they're not really shampooing all the hair all the time.
Okay.
And I think people wash more than they need to. We're starting to understand a little bit more about the microbiome of the scalp, the microorganisms that live there and the value that they have, and where that dysbiosis or an imbalance of those microbes could be causing some of the inflammation that drives hair. Because it seems like with every single type of hair issue I've mentioned to you, there is some microinflammation at the base of the follicle that is driving some of the processes. And the difference between whether you end up with scarring or non-scarring or autoimmune can be whatever you're prone to, but there is some microinflammation or macroinflammation, a
Right.
little or more inflammation at the follicle in all of them. And one of the things that I do is I do cortisone injections into the scalp for all types of hair loss, even not so much for natural hair aging, but for the androgenetic types and the autoimmune type and the scarring types. So the other things you could do at home, I think also, or just not in the doctor's office, is just be careful how much you process your hair, how much heat you put in your hair. when your hair is wet, when you brush it hard, it's a little looser in the follicle. So the time to be the gentlest with your hair is
Yeah.
right after you shampoo it. So if you're
Okay.
brushing it, sort of hold it up and brush from the ends up, but don't pull
Okay.
it when it's wet because you can literally pull your hair out. So
Okay.
use a brush specifically designed for wet hair and use products that are gentle. I remember I was at camp as a kid
Yeah.
Essence or that green shampoo. I think it was Clairol Herbal Essence at the time, and my hair just came out in clumps. And I wasn't thinking about hair. I was 12,
Yeah.
but it definitely affected my hair. So I don't think there was anything wrong with the shampoo. I thought it was just not good for my hair. And then I just stopped using it because it happened every time I used it. So if you use something and you're seeing that it's not good for your hair, it may not be that it's bad, it's that whatever that is not good for you, switch. But there are some good ones. I think the Julian Farrell Restore shampoo is really good. The Redken acidic bonding concentrate shampoo is good. It makes your hair thicker. Aveda has an Invati line that's really good, and they have a good hair thickener for after that makes your hair seem like 5 times more hair,
Yeah.
which is really nice. Um, so I think those are all fine. Over processing, over highlighting, over bleaching. I know if you're going to do that, and then if you just swim in a chlorine pool on top of it, you're going to create problems in your hair. So think about what the processes are that you're doing to your hair and what that looks like on your hair, and just try to protect it from that. So if you want the color, then just don't overheat it after.
Right. Right.
So to balance it out.
And how important are is hydration and diet in terms of, our hair health?
Well, the hair is dead. That's why we can cut it. Once it grows out of your head, it is what it is. So it's really the hair at the
Yeah.
scalp and the scalp itself that you're trying to protect. One thing you don't want to do is keep pulling your hair to check to see if you're losing hair because you're literally pulling it out.
Yeah.
Um, Diet is always important, especially for the hair. Biotin doesn't do much for hair. Most people are not biotin deficient, but I do think the gut has something to do with the biome of the hair. So the gut is connected to everything, and actually, we now know we have estrogen receptors in the gut, and that changes around peri and post menopause. So we have to pay attention to that as well. Having a healthy diet, getting enough protein. I think collagen supplements are good for the hair too. There's not enough data on this. It's not an FDA approved thing, but collagen, the most abundant protein is collagen, and
Right.
your hair it supports the scalp, it supports the blood flow, it supports everything. So I've started to add collagen powders, and I think there's 3 really good brands. I don't know if you want me to mention names or not, but
Yeah, I
there's
mean, I think, and we did talk about it with the skin, and I had asked you about collagen, and so knowing like that, it can help hair is great. And I think, yeah, I mean, I think if there's product lines that as as an expert that you enjoy, that's great for the listeners to hear.
I like Liquid Biocell, I like Skin Aid, and I like Nutrafol. There
Mhm.
are 3 different collagen brands that I think have put the most effort into explaining how they could work. I think Skin Aid is British. I'm not sure if it's British or not. Liquid Biocell is just a brilliant product as well, and then Nutrafol is the newest one to the market. Then they added some other good things into it as well that to me make it stand out. But I don't like collagen gummies or um, collagen pills. I think it should be a powder. And
Okay.
it's a protein. So collagen is a protein. It's not going
Yeah.
to go through your system and then end up as collagen on the other side. It's going to get digested and broken down. And it's a heavy protein, which is why I don't like it to be as a gummy or a powder. I think it should be with fluids. So with the liquid, either in a smoothie or in a drink. And what happens though is that while it gets digested and metabolized, it gets broken down to the building blocks. It doesn't get broken down to nothing. It gets broken down into things that are still the building blocks for collagen. And I think that the marine source is probably a really good source of it.
Yeah.
There's usually from fish scales. So if you're shellfish allergic, even though it's not shellfish, there you can't know for 1,000% that there's no shellfish contaminant into it.
Right.
So you just have to be careful there. But otherwise, marine collagen, I think, is probably the most well-absorbed source.
And if we switch from hair on our head, I get so many women asking, why the heck do I get these random black hairs on my face? Why does this happen?
You're lucky if it's only a few random ones, and you're lucky if it's black because it can be lasered. But it's the same hormonal imbalance that will cause you to lose hair or thin hair on the face that will cause you to grow hair where you don't want it to grow. And that's the problem is that it's an hormones are very interesting. A hormone is a hormone because it's made in one someplace else. And if you think of it as like a light switch, a very little bit of hormone can have a big impact. You flip a switch and the whole room lights up. And if you have a kitchen that's a big kitchen, you could have a light switch where one side could be up, but the other side could be down, and they
Right.
flip back and forth. So it's kind of like that, where this switch, when it's on your head, it will affect hair growth. But if it's on your body, it affects it differently. So they'll have opposite effects, even though it's the same hormones. Just
And
how
what
it is.
and what role is the sort of that estrogen testosterone ratio in that your estrogen's declined, and so it's not that your testosterone's too high, it's just that that ratio. I think it's the
Yeah.
analogy that you're sharing with the light switch. Is
Exactly.
that
It's
right?
estrogen, progesterone, and testosterone that they're just not in the right balance
Right
for
balance.
the age. So I actually don't know what the balance is, which is why I don't prescribe the hormones,
Right.
but they're definitely not in sync. And the thing about hormones is I mentioned it's like a light switch, so it's very little that goes a long way. One of the issues that we had around hormonal contraceptives when they first came out was that they didn't understand that you need so little. So they were giving women milligrams of estrogen, and they were getting liver cancer and having all these liver problems and horrible side effects. And then they realized that they need micrograms of it. You need so little to have a big effect. So hormones made one place, act someplace else, a little bit has a big effect. And the thing is with these hormonal imbalances, one of the reasons that I don't know the answer to is that what I've seen sometimes is that people will come in and all their hormones, their blood levels of hormones will be perfectly normal, yet they have a hormonal problem. And oftentimes it's hair growth where you don't want. So either it's a local hormonal effect or what I call a hormonal hypersensitivity. So I think we don't really fully understand the effects of these hormones or the connection to the gut and to the microbiome. When you think about it, we're more not us than we are us. We're teeming with microbes. We're
Right.
inside, outside, like we're just teeming with microorganisms that are affecting us, usually in good ways, but when they're out of balance, it may not be so good. And we just don't really fully understand that interplay and that connection. But we're
So,
starting to.
so for women who start to sort of experience a big hair loss or they're noticing it, it's late, but how important is it for them to get to a health professional?
I think it's really important because the sooner you treat it, the better the chances are of recovery or of knowing what to do next. And there's a lot that we can do. One is just having a diagnosis is peace of mind. Is it just a stress shedding? Because you had a stress. So a stress shedding is called a telogen effluvium. And if you go through any physiologic stress, whether it's a breakup or a job change or a delivery of a baby or cancer treatment or marriage or death or divorce or whatever, like whatever happens in your life that's big for you, that can push your hair from the growing phase to the resting phase. So
Okay.
the growing phase is 2 to 10 years. The resting phase is to the shedding phase is 3 to 4 months. So as it pushes it to the resting phase, 3 to 4 months later, that hair will fall out. So at any given time, in general, 90% of your hair is growing. 10% is shedding, is resting or falling out. But if you go through that stress, 30 to 40% all at once can go into that resting phase. And then 3 to 4 months later, you see a massive shed. That hair is just cycling wrong and it
Okay.
will recycle back.
We'll go
But,
back.
it will go back eventually, but it can take up to a year. So that is a stress shedding. And oftentimes people are over the stress and then they see the hair loss and they don't make the connection. That's the problem. So when you see a doctor who specializes in hair, We can help. We can look at your scalp. Is there redness? What does the follicle look like? What is the pattern of hair loss? How long has it been going on? What's the family history? What have you been going through? Have you gone on or off any medicines? What's going on in your life? All of these questions we can ask to try to understand what's driving this hair loss and what the best approach is to help it. So whether it's PRP or cortisone shots or laser therapy or a JAK inhibitor or one of the other treatments that we have, there's so much that we can do now, but even just having information is always a good idea.
And last question, because I know I'm keeping you long, but this is such an important topic. And I'm very curious. So, in terms of PRP, which is, extraction of blood, centrifuging it, and re-injecting the
Sure.
good cells or the stem cells,
Yeah.
you'll correct
The
me, back
platelet-rich
into your.
plasma. Yes.
So, is that something for women who are having natural
Sure.
um, hair loss, or it's just dull
Yeah.
and it's not, is that effective to kind of give your hair a boost as we're aging?
I think it works for about 85% of women. In our office, we always do a laser first. So we
Okay,
have a Photona laser. We have something called the hair laser, and it will prime the follicle and sort of wake up the follicle. And then we'll do the PRP. And we have some other topical things that we do along with it, but it does help rejuvenate the follicle. And minoxidil, because it's not specific to a particular issue, it just helps the hair grow thicker.
okay,
Even I just think of it as anti-aging for the hair.
okay.
So I think most women, it's just they always feel like, oh, but I have to do it forever. I'm like, well, you moisturize forever, you do it.
Yeah,
So if you do this forever, it'll work forever. And you can get it at the drugstore without a prescription. There's
okay.
always other versions that doctors make that have other stuff in it, but you can get it in the drugstore without a prescription. And I just think of it as anti-aging for the scalp. It just helps your hair grow thicker. So it's good
Fantastic.
for just natural aging and for the female pattern.
I think
And
these are,
I put that once a day.
I think these are incredible options. I think women aren't as knowledgeable about, hair options like Botox for the hair, as they are for their skin. So I
Yeah.
think this is really important to know what options exist if it's important for you and you want to give your hair a boost.
Well, hair is really tied to our self-esteem. It's not that we choose to care about hair, it's that hair is something that is hardwired into our DNA to care about. So people care about hair. They can't really help it and they need to not judge themselves for caring about it. It's normal to care.
No, I think whatever makes you feel good, you have the right to invest in whatever makes you feel good, and
Okay,
so that's it. So, well,
great.
thank you so much for your time. I'm sorry to keep you late, but
Happy to be
I
here.
think this has been so important for women to hear, and we love you. So, thank you so much.
Yeah. Thank you.
Talk
Bye.
soon. Bye.